I'm here today with Judy, and Judy is a cardiodynamics patient. And for anyone that's out there that might not be sure what or might not know what cardiodynamics is high-tech equipment that deals with preventive medicine. And some key things to probably put in there is the fact that cardiodynamics is non-invasive, but what it does is it tests for your risks of heart disease, hypertension. In this case here, we've got a case where, Judy, you actually used the cardiodynamics to detect cancer.
Yes, that and I had seen some other doctors, but in my life in reading, I knew that eating well, and I discovered this when I was probably about 42 or so, when I realized most of the people I had known as my friends and family were slowly gaining weight because they were overeating. And I had made that choice when I was about 45 years old, I'm now 70, that I would begin to eat correctly. I was eating fast foods, I was eating cream puffs, I was eating everything wrong that I should eat. I thought drinking a glass of milk was the best thing I could do for myself, not realizing that it was fruit and vegetables that were needed in the correct amount, and I wasn't eating them in the right way. I had maybe, if I had green beans at a meal, I thought, well, that's my vegetable. If I ate an apple there, that's my fruit. I didn't realize it was a combination of fruits and vegetables, and the number of them that is mostly important. I would have a steak probably the size of my hand and thought that that was something because it was protein. I now have, I don't eat much meat, but I do have a lot of chicken and fish, especially salmon. And the size is important. It's about the size of a pack of cigarettes, that's about it. But it's what else I have along with it. And so broccoli, which I never ate when I was growing up, I would eat broccoli, and along with spinach, and I have cut out white bread, white potatoes, white rice, and I've substituted the whole wheat and brown rice. And as far as I was never one for eating a lot of fruits, and my mother, I know, is smiling down on me today because she's saying, good for you, Judy. She'd say, why don't you eat more fruit? Well, I am today. I have plums, and I have apples and bananas and guava and all the fruits that you can imagine I just love, kiwi, and I put them in salads, and I'll prepare them in different ways. So I know all of this that's going into me is going to give my cells energy, and if my cells have energy, then I'm going to have energy. So I'm very happy to be with a doctor today, to be able to talk with him as to how he can even help me. Dr. Brody, I would say, how can you help me be even better than I am? You know, so that the years that I have left are going to be good years.
Right, and that kind of ties back in a little bit to what we're talking about, which is the preventive medicine, and the fact that Dr. Stephen A. Brody, who we're in his offices today, uses the cardiodynamics equipment to kind of give you a road test, if you will, or a pulse on exactly where your body's at and exactly what things it might be needing or what it might actually be lacking, but also to give you an idea of what particular ailments that you might have a very high risk for. And then that's great information because, number one, you look fantastic, and I would never guess in 100 years you're 70 years old. You look great. But also, you're a person that has gone through this cardiodynamics, and you were actually diagnosed with pancreatic cancer. This was back in 2000. We're shooting this video now in 2009, actually in August. And when you originally went to the offices and you originally met with the doctors for the cardiodynamics equipment, that preventive test that you got actually really helped almost save your life.
Absolutely. You know, I knew nothing about it, and when it was Dr. There at the Life Score, oops, sorry.
That's right, no.
Dr. Michael, and he was the one that said, this is what we've got to do for you. This is the plan, and we're going to get you healthy. And we're going to get you on fruits and vegetables and these things that you need that you have been on, but we're going to have it even more. So I thought to myself, this is it. And I went, when I went home, I spoke with my husband Bob, and he's here today, as a matter of fact, because we wanted to change lifestyle, the two of us, and make it better. I mentioned to you before that
Right.
I was eating more fruits and vegetables, but this is going to be an even more impressive um, walk with life as long as we have left, and I'm glad Bob is here today.
That's fantastic. Well, I can tell you from a guy that's doing the filming today, it's really been a pleasure not only to hear your story, but to be able to meet you and Bob. And I love going through and seeing the people out there like yourself that are really taking a hold and taking control of their lives and eating better and exercising and doing all the things it takes to really live a fulfilling life. And I want to thank you again for this second video that we've done, for sharing your story and giving us all this fantastic information.
Welcome. Just remember, we've got one body. Let's keep it great, huh?
That sounds good. Judy, thank you so much.